My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Science at Boise State University. It's a great pleasure to introduce Michael from Midwestern University, and he's going to be talking about several of the programs at this wonderful institution down in Arizona. And I'm going to let him take it away.
All right. Well, thank you so much, everybody, for having me. Again, my name is Michael Matisak. I'm one of the senior counselors at the university. So I do work with pretty much all the programs, but kind of my specialty programs are PA, veterinary medicine, and speech pathology. So, but I have a broad knowledge of all of them. I've been at the university for about 8 years now. So hopefully I can share some information with you and give you a little knowledge in regards to our processes and what we're looking for in candidates, so you can more aptly prepare yourself. So I will go ahead and just share my screen here over quickly. And so PowerPoint. Get to the next page. So I usually just start with this real quickly, just so people know, and a lot of people do them, maybe they don't, but we do have 2 different campuses. And our original campus is based in Downers Grove. That's kind of like our mother campus, but we opened up the Glendale campus in '96, and now we've actually outgrown the Downers Grove campus. We have more students, we have more programs. But the one thing to keep in mind, the real reason why I tell people this is because even though we are one Midwestern, we do operate independently. So we have obviously different faculty at each campuses, different deans, all that different stuff. So depending on, who you're applying to, it's going to be looked through a different lens, because you can apply to both campuses. Like, for instance, PA does exist on both campuses. So if a student just wants to get into the PA program, they may apply to Glendale and Downers Grove, and just to obviously broaden their chances of being accepted somewhere. And you could get accepted into one and not into the other. But obviously, if you have no desire to live in Illinois or Arizona, always just apply to the campus that makes the most sense to you. And then this currently is the programs we have, and I'm going to focus all my attention on the Glendale campus. That's where I'm based out of. So that's where all my information will come from. But this is currently the programs that we have. We do continue to, grow as a university. But one of the core tenets for us is that we are just a graduate health school. We will never, wander from that and add on business or something like that. It's always going to be healthcare related. Anywhere that we see a need in the community, then they're willing to expand. So, we've added a lot of these nursing programs in the last year or so, as well as some dual degree certificates for certain programs where people can, go towards Master's Public Health or precision medicine. So those are what we currently have going on. And then we do have several clinics on campus. So depending on the program that you're enrolled into, you may find yourself doing a lot of your rotations right here on campus, which is obviously very convenient. For our dental students, they never leave campus. They can do all of their rotations on campus. We have a giant dental clinic with about 35,000 patients every single year that come through the doors. So they have plenty of experience working with them. But on top of that, we have our eye institute. So our optometry students do their first year's worth of rotations over there. We have a great veterinary clinic. It's actually the largest teaching hospital in the country. So our students get a lot of experience over there. And then outside of that, we've added on a brand new therapy clinic. So we have OT, PT, speech pathology, clinical psychology. All those have clinics embedded with them. So students can do some rotations over there as well. So what I'm going to do is I'm going to go through pretty much every program we have. Some I'll elaborate a little bit more on, but I just want to kind of give you core statistics. So you have an idea of, what our classes look like, what the demographic is and kind of like competitiveness. And so you understand what you need to do in order to kind of get yourself into a better light. Because myself as an admissions advisor, what I always advise people is I can really push you to tell you what's going to make you competitive to get to an interview. Then the interview is up to you. What you do with that, because interview is obviously, a big component of the final acceptance as well. But the first part is getting to that interview stage. So these numbers that you're seeing are generally our classes that sat the previous year. And since we have so many programs here at Midwestern, we have different start dates. So for instance, coming up here the first week of June, that'll be when our PA, our PT, our PA program, and our doctors of nurse anesthesia program will start. So they all come in June and they get going. And then usually I think this year, actually, it's the last week of July, maybe the first week of August is when our DO program, our osteopathic medicine, as well as our podiatry students come to campus. So that's about another 300 students. And then the last week of August is when all of our other matriculating classes will come to campus and begin their orientation and start their classes. So what you're going to see here is everybody that started last year, 2021, and kind of what those core numbers look like in terms of acceptances and stuff, on an average. So, DO, again, that's our biggest program on the campus. We usually take about 250 is what they look at, but we usually land about 253, 54, somewhere in that range. So I make no qualms about it, and when we talk about this, academics are always going to be heavily evaluated across the board. I think with most programs, that whether they say it out loud or not, I mean, that is your kind of core driver. That's what programs are looking at, especially programs at this level in terms of student success. Now, there's a lot of other things I'll go into, and I'll talk about that as we go through this presentation. But, first and foremost, they want to see, were you a good undergraduate student? Because it doesn't get any easier at this level. It gets considerably harder, in terms of just the workload that you have. So they want to see, and again, you look at our numbers, and this isn't 4.0 students, it's not 3.9, you're averaging around a 3.5. And then your MCAT score, that's another key driver. So any of you that are interested in medical school in general, whether it be allopathic or osteopathic, MCATs are very heavily evaluated. There's a lot of studies and stuff that show a definite correlation between MCAT performance and board performance. And so that's why our university has always kind of clung to the MCAT and, in terms of like a driver and telling us in terms of student success. So, for us, we've always kind of been in this range of about a 3, 4, 5, in terms of our average in science GPA. And the MCAT score is historically almost always been at 507. I've been here almost 8 years. Almost always been at 507, our average score for acceptance. And it's important. I can't tell you the number of people every year that I see that have literally 4.0 GPAs and then MCAT scores that are like a 500, and they don't even come close to an interview, So the MCAT score, to me, you'd be better off set to have a 3.3 GPA and an MCAT score of like a 512 than to be a 4.0 student with an MCAT score of a 500. Now, the MCAT score obviously is a little easier, I think, to rectify than a lower GPA. So, you have a lower GPA and you got to bring that up, then obviously it's just going to be additional coursework. With the MCAT, sometimes it's just additional prep, and people are able to overcome that and raise their score up. But outside of that, you can see, we usually get around 7,000 applications each year, about 800 interviews, and then ultimately a class of 250. So, and then you'll see kind of this reoccurring theme too, like our campus is generally about 75% out of state to 25% in state. So here you can see it's 30% from Arizona, meaning 70% comes from out of state. I think a lot of that I kind of attribute to the fact that we are a private school. We don't allocate or contract seats to in-state universities. So for us, like, we really could care less if somebody went to ASU or University of Arizona, great, but we're not going to put them on a hierarchy above somebody, from Boise State who has a better, profile, better GPA and stuff like that. So we're just looking for the best candidates regardless of where they come from. So, of course, in regards to the DO program and a lot of your 4-year kind of medical programs, a lot of times it breaks down to being like 2 years of didactic and lab, so your lectures and your lab studies, and then 2 years of clinical rotations. We are a quarter-based school, meaning that you normally have about 10 weeks of classes. The only difference is your very first quarter in the DO program is actually 12 weeks, because they actually want to give students a little more time to get acclimated to the actual workload, because it's pretty intense. But then after that, you're pretty much on this strict schedule of 10 weeks of study. Usually get like a week and a half or a week break after that. And then it's back into the classroom. And then we do have a little bit more extended breaks around holidays and things like that. So you'll have some more time off. And then rotations, that's generally what you're going to get into. Like I said, after your first 2 years, we give students the opportunity. There's 3 different real rotation sites that we kind of will place our students. And a lot of times it's either here in the greater Phoenix area, in the Chicago area, or Los Angeles, San Diego area. So students actually will rank their preferences when they get to, it's generally their second year, where they want to go. And then normally they say about 80% of students get their number one choice. So you may not get your number one choice, but you'll pretty much always get your second choice. And then students do have the opportunity to switch too. So in that occurrence that maybe you've got your second choice and also a classmate got theirs, but you guys could switch and have your first choice, they'll allow you to do that as well. And then you can kind of see the core rotations that you have to complete. And this is pretty much set with medical school. And then you'll have some non-core rotations. And then you'll get into some elective ones down the road as well. All right, pharmacy, I won't spend a lot of time on this, but we do have a pharmacy program. It is a 3-year doctorate program. So, most of your pharmacy schools are going to be a 4-year track. This is 3-year, but it's expedited. So it is intense. The students are done in 3 years, but it's a decent sized class. We usually take about 135 is what they shoot for. I think last year was on 133. But you can see in terms of the GPAs, not quite as high as what you're looking at med school or like even PA school. We no longer require the PCAT. So if you're not familiar with the PCAT, it's kind of like the MCAT, just more pharmacy specific. And the GPA minimum for this is going to be a 2.5. So it's actually the lowest GPA of any of the programs on campus. For the med school, it's 2.75. When we look at PA, it's going to be a 3.0. But it is a pharmacy program that's pretty well respected. So if you're looking at that, it is available here on our campus. So our dental program. So this is one of the more popular programs that we have. It's a very, very competitive program. But again, it's not all numbers based. So you can see like even our GPAs, we're not looking at 3.9, 4.0 students by any means. Usually around a 3.4, like last year was science, overall is 3.5. So if you're sitting in that range, feel pretty comfortable. Really, I think if you're above a 3.3, you should feel pretty comfortable. The DAT, again, so the DAT, that's like the entrance exam, similar to the PCAT and the MCAT. That is something that you're going to have to take. And if you're not familiar with the DAT, much like the MCAT, the PCAT, there's just different sections within that test that was testing you on like, biology and chemistry, reading comprehension, all these other subject matters. So within each one of those, I think the highest score that you can actually achieve is a 30. I think that's a perfect score. So for us, our average is around a 20 for each section. So you really want to try to be in that range, not too much lower. Really, I would say 18 is about the lowest you want to be in any of the sections. But if you can get above that, then it's just going to make you that much more stronger of a candidate. Again, we get about 2,500 applications for them, do about 600 interviews, and we take a class of about 145 each year. So, and as we get a little bit further into, I'll talk about interviews and kind of those formats and stuff like that. But right now I'm just trying to give you a little bit of the numbers and the layout of the programs. Again, so, we're really looking at patient-centered candidates, people that we bring in. Students get a lot of training with CAD/CAM. So it's like your same day implant, or not implants, crowns, things like that. You do get implant endodontic courses, things that a lot of times you'd almost have to go into an additional like year of training after you complete medical school to get. A lot of students can actually get that within our programs because of the training they get and the patient amount that we have as well. They do get certifications in lasers and Invisalign as well within our program. That's embedded into it. And then our dental institute, which is our clinic across the street, we got 242 chairs. So it usually works with 2 students per chair. Normally one of them is working as the actual dentist. The other one is working as a dental assistant as they're going through this. And then as you can see, 35,000 patients every year with about 500 patients monthly. We're really well positioned here. We're actually neighboring to Sun City, which is a huge retirement community. And that's where we get a lot of our clients from, really for a lot of our clinics, but they bring in a huge caseload for our students, which is great because it's just more practice for them and for you to just hone your skills. Optometry, another program that we have here obviously on campus with a pretty extensive clinic as well. And you can kind of just see the layouts of the numbers. I won't go too much into that, but about 3.4, 3.5. Not quite as many applications as you're going to see with some of the other programs like dental and PA and things like that, but still competitive in terms of the GPAs. The OAT, that's their entrance exam. So there's two different sections. There's a science section, and I can't remember what that section is, but each section basically, I think, has a maximum score of like around 350, which means you could have a 700 high score. So our average OAT's around the 623. So they normally want students to score at least 300 in each section. So if you're coming in above that 300, feel pretty good about yourself. And if your GPA is in this range, also feel pretty good about yourself. With all of these programs too, I kind of glazed over it, but you are going to need letters of recommendation, and pretty much all of them are going to want at least one from a practicing professional from that range. So, this would, they want optometrist, a letter from an optometrist. Pharmacy would want one letter from a pharmacist. DO wants at least one letter from an MD or a DO. So that's something right now, if you don't have, when you're looking to get into one of these fields, start establishing those relationships. So you can get somebody who feels going to write you a good letter, and it's not somebody you shouted with for like 3 hours, because it does come through in the letter. And that's something that we can definitely tell, like how actually deep of a relationship the candidate has with the person that wrote the letter for them. And then back to optometry real quick, so you do have, like I said, a clinic here on campus where you would do like generally your third year, but then they do a lottery system actually to assign the fourth year students, their actual clinical rotations. So a lot of times they'll do like their first quarter at the Eye Institute, and then 3 quarters at external rotations, which we have rotation sites across the country, literally like in Hawaii to Maine to all these different places. So students can really go about anywhere they want to. And then they have all these specialty areas they get to work with them as well. All right, PA, because I know this is a big one for a lot of people. So our PA program, and I don't make any qualms about it. I think PA is about the most competitive program there is on campus. I think nationwide PA is probably becoming one of the most competitive things there is, because people see the opportunity to really almost do the same thing that doctors do without the extensive training in terms of medical school and then your residency and stuff like that. So it's just a lot of times, what we're really gauging is, are you okay still not being the top dog? Because with some students, that's what they want. They want that role of being in charge. In medical schools, ultimately that's going to put them at the very top of the food chain. But with PAs, you're still an assistant. You have somebody that you're working underneath. But a lot of times, you are pretty much free control of whatever you want to do. So, but that being said, you can kind of see the numbers. They do have pretty much the highest academic standards of any of the programs here on campus. So those are our averages. I usually tell students, if you're coming in, I think honestly, if you have above a 3.4 overall in science, you have good GRE scores and good patient care, paid patient care, you're probably going to interview with the program. But all 3 of those have to be on point. If any one of those is lackluster, I can pretty much guarantee you're going to be waitlisted. Even within the GRE, just to give you a little bit of perspective, if you've ever taken the GRE, you're familiar with the GRE, there's 3 different sections within there. There's a quantitative, qualitative, and analytical. So basically reading, writing, and math. And each one of those sections is going to give you a percentile score. So, again, our average is around 69 percentile. They want at least a 50th percentile in every single section. But, I've seen scenarios where students had 3.8 GPAs and 80th percentile, 80th percentile, and 20th percentile. And that 20th percentile in that one section got them waitlisted because they weren't good at math in their GRE. So just keep that in mind. It is that important and that competitive, that something like that, where you think, oh, everything else looks awesome. That one little glaring kind of weakness can 100% put you on a wait list. So, it has to be low, if you were 80, and 40, you'd probably still interview, they would probably be a little concerned. They'd probably put a note in there a little concerning score, but, it is one of the things where I think almost yearly, the thing I see that gets students waitlisted the most is GRE scores, because their GPA was good, their patient care experience, but their GREs were, 30th percentile or something like that. So if you take the GRE and you get scores like that, at least from my perspective, working for Midwestern, you need to retake that GRE. You're not going to get accepted into our program with low scores like that. So, But if your GREs are good, I mean, I think it would be better, honestly, like I said, I would prefer it to see you in the scenario where you had a 3.5 or 3.4 even GPA, you had 80th percentile GRE scores, you're gonna have a way better chance of interviewing than the flip side where you have a 3.9 GPA but 30th percentile GRE scores. I think they value the GRE quite a bit. So the other thing, like I said, paid patient care experience. So if you go on our website, there is nothing listed as like, oh, minimum amount of, where a lot of PA schools will say this is the minimum amount of patient care hours or whatever it may be that you need to apply to our program. So we don't have anything stated on our website, but I can tell you internally, you need to have paid patient care experience to have any chance whatsoever to interview with our program. So I would really say to be a competitive applicant, you want to have at least 500 hours of paid patient care experience. And patient care experience there are a range of different things. We get a lot of people that are scribes, and we get medical assistants, and we get CNAs, and we get EMTs. We get a lot of tech positions. So there's a lot of stuff out there that is it really, they're just looking for something that's not like where you're doing like back office, like filing or something like that. Something where you're actually on kind of the front lines, working with patients, in whatever capacity that may be. And if you're wondering, you can always obviously leave my information at the end of this, but you can email me and be like, hey, I'm doing this, or I thought about doing this. Would this count towards patient care experience? I'll 100% tell you. But like I said, you'd really want to come in with at least 500 hours at the time. And that's at the time of application, because if you apply and you're like, well, I've got 5 hours, but I'm going to be working there, like they're looking at it from the time when you started. And students can always add on to their application, and that helps down the road, but it doesn't help you at that time of application, because that's when we're determining whether or not we're going to interview you. So sometimes people interview with, maybe 400 hours, and then, they're placed on like maybe an alternate list because their hours are lower, but then they send us updated hours as we go each month, and all of a sudden now they've got well over 1,000 hours, and that just makes them that much stronger. But like I said, if you apply early on, nothing, literally nothing, which we do get, you're almost guaranteed not to interview. So make sure you seek out those roles, or at least keep that in your mind, because we do see that too, where people put their emphasis on just academics, which is completely fine while they're in school, and then they take a gap year to gain that healthcare experience. So during that year out of school, they go and work as whatever, in patient care, get that experience under, apply that next year, and then they're ready to go. But if you feel comfortable, or if you have a role already where you can be in school, and then also getting some paid experience, because it does need to be paid. Keep that in mind. It can't be just volunteer. If you have volunteer work, great, that works, but they're looking at it through the lens of it's your job to show up and do it, and that you can't just volunteer kind of when you want to, and like it's like this, you have the schedule that you have to adhere to, and you have to show up and do this. And so that's why they want to be paid patient care. So but outside of that, I mean, you just kind of see the numbers. We usually take about 90 students. That's where they want to be. We were 1 over last year, which they honestly do not like to be over in their class size. So they always try to hit it right on the 90. So that's what we take with about 1,700 applications. We do interview about 300 or so students each year. So, and then prereqs, I'm going to I like to throw these up every now and then. All of you guys should kind of know, you can go on our website, and you can kind of see, and I think from university to university, prereqs are going to be pretty similar in terms of what they're looking for, biology, chemistry, OChem, those type of things. For us, 8 hours. So really you have to have like at least one biology, just general. Most people are going to use like a gen bio, but we do see people, because you have to have 4 hours of anatomy as well. So I'll see people that do ANP1 and ANP2, and that satisfies that whole requirement, because you essentially have 8 hours now of biology with labs. So that works. It doesn't have to be gen bio. It has to be just something through the biology department. So if you've done it that way, great. The rest of those, kind of makes sense. You'll do see, we put, so they've always been pretty strict, and this was pre-COVID, about labs being taken online. They never wanted it to be done. Obviously COVID happened, and that was kind of not a choice for anybody. Everybody was taking them online. So we've been accepting labs taken if they were only allowed because of COVID. I think going forward, once schools have kind of I think a lot of them are kind of getting back to normal and labs are offered in place or in person. They want to see that. So if you have the ability, your university's offering it in person, take it in person. Do not take it online, but they have been, extenuating circumstances, they have been accepting it because I knew students had no other choice. But if they know now you have another choice, there's definitely a chance they will not accept your lab if it was taken online. Everything else should make sense. Math, college algebra or higher, English comp, and English really will take anything. And this goes across the board. So if you've taken classes, obviously in the English department, but even like literature classes, public speaking classes, stuff where it's basically communication, if you've taken writing intensive classes through, biology department, all that, we're not going to make you jump through hoops for English comp, unless there's just nothing you've ever taken that even kind of falls into that realm. But normally students have something that is considered an English class or writing heavy or something like that through their university. Social behavioral, so sociology, psychology, anthropology, political science is another one that we'll accept for social and behavioral sciences. So you just have to take a couple of those classes. Statistics can be any statistics class. If it has the word statistics in it, we literally will take it. So it can be an intro statistics, it could be any other type of statistics, but as long as it says statistics in the title of the class, we'll take it. And then biochemistry, it is not required. You do not have to take that as a prereq for us, but they do encourage it just because you take biochem as part of the curriculum here. So it definitely gives students a kind of upper leg, they're ready to go and they're kind of familiar with the content when they get into that class. And this just kind of gives you an idea of what your schedule is going to look like. So, and this goes across the board. I could have probably put any of our programs up here and shown you what the schedules look like, but it's full-time job, and that's why we don't really see students who ever work at our university. Like very rarely. Certain programs I've heard of students that have, a part-time job or they do like Uber Eats or something on the weekend, but you're here 8 to 5, Monday through Friday. This is a weird schedule I pulled up, and it's a little bit, as you can tell, as it gets older. I've had this in here for a while, but you're here every day of the week and you're generally taking exams. And now you're not doing an exam Monday, Tuesday, Wednesday, Thursday. That would be really terrible. But you probably are taking an exam every day, every week. I mean, that's kind of how the structure is. With a lot of our programs, like they do multiple exams throughout your term, where that way, when you get to like, finals and midterms or whatever, they don't have the weighting that they do at a lot of other places where, if you failed your midterm, you failed the whole, quarter, you're pretty much out of the class. Here, if you fail your midterm, it's just like you failed any other exam. And same thing kind of like the final. So it does put more testing on the student, but it also takes away some of that stress of knowing like you really need to kill it on this last exam, otherwise you're going to fail the class. So, but you can just kind of see it's pretty much day after day. And your schedule is going to change by quarter. There'll be, certain quarters where, you don't start your class until maybe, because you can even see here, they have this blocked off for exams, that's just blocked off, but you can even see here. So like on Monday, Tuesday, they don't even need to be on campus until 10 o'clock, and then they're done by 3 o'clock on Tuesday. So you're going to have these changes in your schedule. It's not like you're here 8 to 5 every day of the week, but in the beginning, you kind of need to plan on it until you really find out what your schedule is going to be. And then rotations for PA. So there's 7 core rotations that you have to do, whether you want to or not. So family medicine, general surgery, internal medicine, women's health, pediatrics, emergency medicine, psychiatry. And then you have to participate in at least 1 clinical rotation at a rural or urban medically underserved site. We have all the rotation sites already set up for you. So you don't seek out anything yourself. We've got them already planned. Majority of them are within Arizona, but we do tell students like, depending on what's going on, you may have to go to, California, Colorado, Idaho, New Mexico, Texas, or Utah. But students find that out 6 months in advance. So if there is a chance like, hey, we need you to go, back to Idaho or to New Mexico or whatever, you'll have ample knowledge of that happening, because it is up to you to figure out where you're going to live while you're on your rotation. So we get the rotation set up and who you'll be rotating with and all that stuff, but it is up to the student to figure out housing. We do have subsidized housing in certain locations and stuff like that, so lessens the burden on the student, but it's not always the case. So students do understand that they do play a role in that as well. All right, PT class, or yeah, PT. So this is, we usually take about 55 PT students each year. And we've got about a 5,000 square foot lab here on campus. So it's a pretty sizable lab that our PT students get to work in during their time on campus. But again, not one of these programs where super high GPA requirements. I know a few years back, really, if you came in and you had a 3.1 science GPA, a 3.4 overall, and an average GRE of 50th percentile, they were going to interview you, like that, guaranteed. If your statistics fell into that category, you were pretty much guaranteed an interview. Now, in years past, and I think even now, they still require, I think, at least 60 hours of PT shadowing. So they do want to see that you shadowed, a physical therapist in some capacity. And I always tell people, and I think this is kind of true also across the board, especially, with PT, OT, but really understanding like the capabilities and what you can do within that field. Because I think, especially like with PT, a lot of times you hear people that just want to do like sports medicine. They want to go work for sports, be a physical therapist, which is great. But there's so many other areas of physical therapy out there that students can get involved in, or people, that work in the field get involved in. So we used to actually make students get at least 10 hours of acute care. So they had to go into a hospital setting and actually, show that they understood that that was a role that they could do. And so I think that's across the board, even with like, PA, going back to PA, understanding the field of, what a PA does, what their capabilities are on a day-to-day basis, because that's really what comes out in your interview. Like for us, when we're looking at your applications, it's very kind of, like a hard number, in terms of like GPA, test scores, and, do you have this amount of experience here and blah, blah, blah. But it doesn't really help us dive into your mind in terms of like your real comprehension and understanding of the field and like what you want to do with it. And that's what really comes out in their interviews. And so that's where students either thrive or they get exposed, because they don't really even know. And you'll be surprised how many students show up for their interviews and can't really talk about the area that they applied to, at least not in depth. And so that'd be the thing that I would advise all of you, that if you're looking into programs, really try to, obviously get some observation, do some shadowing, but really try to get as much grasp as you can in terms of the field and the opportunities and things like that, because it will only benefit you going forward. So OT, again, this is a, as you can see, we, a smaller program, about 40 students, usually about 400 roughly applications each year. OT got rid of the GRE a few years back. So really, they have a ton of emphasis kind of on their GPA and on observation, so they really, that's kind of what they're catering most of their applications towards, or in terms of looking at, in terms of who they're going to interview, is GPA. What type of observations have you done in the OT field, and understanding of the OT field, just through your application. And from there, we usually interview about 170 candidates, and then bring in a class of about 40 students. And then podiatry. So podiatry actually is very closely linked to our medical program, our DO program. They come in at the same time the DO students do. They're actually, their full, almost first year of studies is all taken with the DO students. So, it's a rigorous program. I think our podiatry program is considered like one of the toughest ones in the country. So it's not for the faint of heart. It's got to be someone who's actually interested in pediatric medicine. But it's a great program. So, but a little bit lower in terms of the scale. So, we do see some students who were originally thinking of medical school, their numbers didn't hit, the marks that they would need, and kind of decided like podiatry was something that was still, interest of them, because you get to do a lot of surgery and stuff in the podiatry field. So they were drawn to that. So MCAT score, obviously 497 opposed to a 507. So a little more comfortable number for a lot of people. But GPA is kind of in that same range as our med school, a little bit lower, but still competitive there. So not quite the applications, 388, usually interview about 123, and we take a class of 40 each year. And then our DNAT program. So this is our Doctor of Nurse Anesthesia. So for a lot of you, like, this would be something that would be in the future, because you can't even apply to this program unless you're a practicing nurse. So you actually have to be an RN and be working in critical care for at least 1 year before you can even apply to this program. But it's a great program. You're pretty much doing the same exact, in a lot of cases, same exact capacities as an anesthesiologist. So just depending on the state that you're in, certain ones allow DNAPs to just, you don't even need anesthesiologists above you. You can operate freely without one. Some you still have an anesthesiologist above you, but you're still doing all the same tasks that they would. So, but something to keep in mind if any of you are looking into the nursing field. And then perfusion, it's another program that we have. This is, if you guys aren't familiar with perfusion, it's cardiovascular. So it's the people that work bypass machines. So if you ever go in for, heart bypass, these are the people that keep you alive. They're trained to kind of keep the blood flow going, shut down the organs that need to be shut down and bring you back when they need to bring you back. So it's a pretty intriguing field. There's a lot of people that aren't familiar with it, but it's gained a lot of popularity over the time I've been here. So we've gotten a lot more interest in the field because there's not a lot of perfusionists that are still out there. It's a lot of people are retiring from the field, so there's a high demand for it. Once people kind of find out about it, they're pretty drawn to it. But it is something that you got to go and take a look at, and it's a pretty tasking field in terms of personal life, because a lot of times hospitals only employ one perfusionist, so you're on call 24/7 all the time. And so that's why with like this, our department requires students 100%, they have to go do shadowing with perfusionists, spend time with them. And it's more so for the personal life aspects of it, most of the job, because a lot of people can do the job, but can you handle like having to leave in the middle of the night, all these other things, where you really, it's incumbent upon you to be with the schedule of the hospital. So. And then our biomedical sciences program, what this is really going to be tailored towards is if any of you find yourselves in a position where, you graduate school, get your bachelor's degree, and you're still not competitive for certain programs. Really ours is geared towards, even though, really students can use this for any of our programs, but really the only ones where we see a lot of students successfully matriculate into is DO and dental. And the reason being is the biomedical program itself is set up much like medical school. So it's about 85% speed of what medical school is. So it's a very rigorous program. And what happens is that once a student gets into the biomedical program, as long as they hit certain metrics and maintain certain GPAs, then they're guaranteed an interview with the program that they're interested in. So, like DO and dental every year, I would say every year our DO program probably takes 20 to 30 biomedical students. And with dental, they probably take 10 to 15, so there's definitely success. And like I said, a lot of times these are students who, their GPAs are probably just too low. You get students that come in that had maybe a 3.0 in undergrad. Well, med school isn't going to look at you with a 3.0, really, to be honest with you. But, if you come in and you get a 3.6 or something in the biomed program, that perks their interest. They understand, hey, this person can handle this because, they've shown they get good grades in this program. The DO program really isn't much harder than this, so they should be successful. So that's why you see that, matriculation from biomed into DO dental. With the other programs like PA and stuff like that, it's not as closely mimicked. The curriculum isn't as similar. And so PA, like I always tell people, like I would not necessarily do biomed in terms of trying to get into our PA program because they just don't hold it in as high regard as DO and dental do. So you're only guaranteed an interview. You're not guaranteed an acceptance to the program. And so that's the thing you have to keep in mind. So you may get an interview with PA, but that doesn't mean they're ultimately going to take you. So, but this is something we can talk about down the road if somebody ever, you first of all have to graduate with your bachelor's degree and then figure out that you can't, you're not having success in getting your application seen by the program you want to see. Clinical psychology, another program real quickly. So this is probably this is our smallest program on campus. They take 27 students. So it's a small cohort of people that are coming in. Clinical psychology is their own little animal. They handle everybody. Like even when people call just to ask questions, we send them. Normally, general admissions would answer questions, but normally if somebody calls in about clinical psychology, we just send them directly to the clinical psych department and let them talk to them, because it's a very small pool. I mean, you can see 200 applications. They only interview about 100 people, class of 27. So, it's pretty tight knit community, and they really like to assess their candidates, clinical psychology. So, they kind of get a feel for people and where they want to go with that field. So. And then vet med. So this is actually a pretty amazing program. We started our vet med program back in 2014. We became fully accredited in 2018. And since that time, we've only started to just increase. Like, when our first year of existence in 2014, we had 600 applications. And so this year we had 1,430. So you can see that we just continue to get more and more interest from people, as we're more and more established. And, vet med is a pretty sought after career field for a lot of people. And that being said, they've got pretty high standards in terms of GPAs. They used to require the GRE, they got rid of it. So again, sometimes I know people don't like to take entrance exams, but I feel like sometimes they can buoy you up a little bit if you have a lower GPA and you crush the GRE or the MCAT or whatever it may be. It puts you in a little better light. But when that test doesn't exist, now all you have is your GPAs to kind of fall back on, as well as like your animal experience. So that's really what they're evaluating in the beginning is GPAs, animal experience. Students do have to have at least a minimum of 260 hours of animal experience. They say veterinary related experience, but it doesn't necessarily have to be with a veterinarian. It just has to be some kind of role where you're working with animals outside of, you own a dog or cat, that's great, but it doesn't count. But, if you've worked in a shelter or you volunteered at the zoo or, obviously working in a veterinary office or whatever, all those roles would work. It's all great stuff to have. So, but you do have to have those hours in place and completed by the time you apply to the program. And then, from there, again, it's a 4-year program where you're doing 2 years didactic here on campus. And then your next 2 years really are going to be in your rotation sites. And they can be, like I said, we've got our own clinic here. We also have a large animal facility on campus. So we have horses and cows and, there's dairy herds out here that we have agreements with. So students can do rotations right here in the Valley, or you can go, across the country and do rotations at other locations if that's your interest. So it's really up to that student to kind of determine what their path is. With the vet med program, they've got a couple different tracks. So one of those being domestic animal care, the other one being a mixed animal track, where the mixed really brings, you're still doing domestic animal care, but you're also doing large animal, and if you want to do some exotic stuff and things like that, you can get that incorporated too. But students don't decide that until their second year. So you've got some time to kind of experience some things before you really kind of try to hone in on what you ultimately want to practice. And I think this is the last program. This is the last one. And this is my program I work with too. So this is speech pathology. So each year we do take a class of 50 students. CSD is a very specific field. So if none of you have taken speech pathology classes, it's pretty hard once you graduate to actually go back and take the classes, because unless you're in a CSD program, and a communication science disorder program, you're probably never took phonetics or speech language development or A&P of communicative mechanisms and that type of stuff. So what we've done, actually, we just started it this year, is we're going to start offering, those are called leveling classes. So what will happen is, we do get students that, and this happens with all these degrees, somebody who went to school, got their degree in journalism, and then decided they wanted to be a PA. Well, you've got the bachelor's degree, you just need to go take the prereqs, and so you see students that do that. Well, it's a little bit harder to go take those prereqs because they don't exist at a lot of schools or community colleges or whatever. So what we've started this year is that if there are students that have that particular desire to go into speech pathology, we're actually going to offer those leveling classes for free. So a student can actually, what they would do is they still apply through the application service, which is called SIDCAS for speech pathology. I'll talk about those down the road here pretty soon. And they would still interview for the program. But as long as they have a bachelor's degree and a pretty decent knowledge of the field of speech pathology, because they'll still interview, if they do well, they would be accepted into our leveling program, which starts in June. So the leveling program starts in June. It's all online, and they would take those 4 core classes And then assuming they pass those 4 core classes, they just naturally matriculate in with the master's program that starts in August, and they're not charged at all for those leveling classes. So it's a nice way to obviously get some students, you know, 'cause every year we'd have people that were interested and they just didn't know how to take the classes. So like, well, we could offer them and we could do it for free. So it's a little incentive, you know, for people to come to us if they are really interested in being a speech language pathologist. But outside of that, you know, kind of, you know, GPAs, you know, you can see kind of middle tier GRE scores. We actually waived the GRE this past cycle. I don't know if we'll bring it back or not. So we were mainly just going off of GPAs. And then, like I said, the speech language pathology knowledge, there's, you know, we don't require any type of shadowing hours, but you want to see that, like, because that's going to come through in the actual interview. You know, that's this type of stuff that the faculty and stuff are going to question you on. It's like, why do you want to do this field across the board, whatever you're applying to? They want to know that you have a pretty deep-seated knowledge of the field itself and a true passion going into that. All right, so that is all the programs in a nutshell. So all I'm gonna do is spend a little bit of time now just talking about kind of how the application process works and what we look for in our applicants. So, you know, every year it starts a new cycle. So we pretty much almost finished past our 22 cycle. So a lot of our programs have reached capacity. There's still ones that are currently filling up, but we're pretty much done with all of our interviews except for a couple programs. But everything comes through these application services. So if you guys aren't familiar with these, you know, pretty much almost every professional medical field has an application service. So ACOMAS is our DO program, CASPA is for PA, ADSAS is dental, PharmCAS pharmacy, PTCAS, physical therapy, OTCAS, physical therapy, OptumCAS is optometry. This one is podiatry. VIMCAS is veterinary medicine, and SIDCAS is for speech pathology. So all the application services just exist really to make your life easier, because, you know, 20 years ago, if a student wanted to apply to 10 schools, they had to send all of their crap to 10 different schools, you know, all of their transcripts, all of their letters of recommendation. It was just redundant. So these application services exist so that you don't have to do that. You can just send all of your stuff to one central application service. You know, they put it into a nice little package, and then you just designate, these are the schools that I would like to apply to. And then, you know, there's going to be an application fee that you pay for each school that you apply to. So there's generally your first application is the most expensive, and then each additional one's an additional whatever the application service, you know, charges you, but you will pay for each one that you send out from there. But they all have their different dates, and these are tentative, and this is from about like a year or two ago. So you always want to just go on and see like when do they open. But I can tell you these are the dates that we stopped taking applications. So, you know, if you apply to the medical school, you know, it opens up pretty early, but if we don't have your completed application by January 1st, then you're out of luck. You got to wait and reapply the following year. And that's the same thing with like PAs, October 1st, dentals, January 1st, you know, and they're all listed here. So I won't go through them all. But, you know, I always encourage people, like, apply as early as you possibly can, because with a lot of these, especially like PA, you know, people are on top of that right away. You know, you're getting applications immediately from people. I mean, you know, it always takes a little bit of time for these application services, obviously, to process stuff, you know, so it's not like we're getting applications anytime in April or really even May, but towards like late May, you start to see some stuff trickle in, because it usually takes about 4 to 6 weeks for applications to be, you know, completed and verified by the application service, which basically, you know, says that they've received all the required elements of your application. They send it to us in this nice little PDF format, and then we're able to open it up and then make an evaluation of you based on that. The main thing I always just like to point out about the CASs that I think catches a lot of students off guard is that they don't accept grade replacement. So, and what that means is, you know, and I don't know how like Boise State works, but, you know, with a lot of institutions, if you went to school somewhere and let's say you failed a class, you know, and then you retook that class and you got an A in that class. Well, what that undergraduate institution does, they're like, you know, great, we're going to take that failure and we're going to replace it with this A, and now your GPA reflects only the A. Well, now when you apply through these application services, that failure comes back to life and it gets incorporated back into your GPA. So very commonly, every single year, I can't tell you the number of people that email me and be like, I got rejected from you guys, and I understand because my official transcripts show I'm a 3.1 student, but now they're actually like a 2.95 because all these other retakes got pulled back into their GPA calculation. And so it's something that students need to be aware of because it exists and that's what happens, and so and I think a lot of it is because they're just trying to keep people on even playing field, because there are universities that don't do that. They don't give students a shinier, better looking GPA. They keep all the grades in there, and so this just keeps everybody at the same level playing field. But it's just something I want people to know, because if you apply to us and your GPA does not meet our minimum, our system automatically grabs it, kicks your GPA out, or kicks your application out, sends you an email and says, thanks for applying. Unfortunately, you don't meet our minimum GPA. And then you just spent $50 or $75 sending us an application that we never even look at. So it's something that just, if you're in that situation, and like I said, I don't know how, Boise State or whatever calculates GPAs, but if they do that, make sure you do a GPA calculation again on your own, and then add in those previous scores back into there. And that way you can just see a true GPA in terms of like what we're seeing and probably other schools are seeing as well. Because it is something that I can't tell you the number of times every year I reply to emails and stuff with people that are in that scenario where their GPA, I think the overwhelming amount of people are fine. They kind of know what they're getting themselves into, or they didn't take enough classes that it substantially changed their GPA. If you took 1 or 2 classes, retook them, it's not going to be like, oh, you went from a 4.0 to a 2.6, that doesn't happen, but you start taking 4, 5, 6 classes, it can definitely have an impact, especially if those were failures. Those can definitely pull a GPA down. So application process. So like I said, once we get that, you submit all of your stuff in to the application service. They look at it. They're like, cool, everything's here, great. Then they blast it out to us. Once we get it, then we'll review your application. So there's only a couple programs here that actually have supplemental. The only ones that we have on campus is DO and dental. Those are the only 2 that even make you do any type of supplemental application. Otherwise, the only application we need from you is that application service application. So CASPA is the only application we need. So once we get your submitted application, we're going to review it. And it's usually reviewed. See, there's a couple different tiers, and that's the problem. Like once we get into admissions, like it'll come to us. And I mean, I can tell you right now, when I get an application, I usually review it within 20 to 48 hours and make a decision on it, whether or not, like, I think we should interview you, whether we should waitlist you, or whether we should deny you. But my decision is not the end all be all. It actually goes from me then to the committee. And so if I say, I think Haley's awesome for the PA program, we should 100% interview her, then now the PA program has to say the same thing. And they may be like, no, we think Haley's a terrible student and we don't want to interview her. And then they're the end all be all, they trump me no matter what. But what I can say is probably 9% of the time, they're going to say exactly what I said, because they've told me what to look for. My job is to take this burden off of them. So they're basically just kind of really quickly going over stuff. And if something just happens to stand out to them occasionally, they're like, no, I think we should interview this person. And I think it's more so the people I say no to that they say yes to. People I generally say yes to, they almost always say yes to as well. It's very rare that I see that. I think it's more so like I didn't notice something that they found to be very intriguing that made them want to interview you, that they decided to interview you, where I said, no, let's waitlist them or whatever. But that's basically the 3 tiers. There's an invite for an interview, there's a wait list, and then there's a denial list. So, a majority of our denies are auto denies. They're the people that applied, they don't even meet the minimum GPA, the system kicks them out. The other ones could be just people that are really far off, so like DO, if you apply and you have a MCAT score below a 500, you're going to probably be denied by us pretty quickly. Like that's not a competitive MCAT score, so you'll get denied there. Kind of the same thing with, PA. If you apply and let's say you have a 10th percentile GRE score, we're not going to deny you right away. Those are just really substantially low scores. So, but then, the wait list gets used quite a bit because it's like, hey, you've got a pretty good application. You're just a little weak in an area, so like GRE is a perfect example. So maybe you have a 3.7 GPA, pretty decent healthcare experience, but your GRE scores are like 40th percentile, like they're going to probably waitlist you. And they'll say, like, we'd like to see them retake the GRE. And if they do that, we'd be 100% willing to interview them. But, there's something there that's a little weak and we'd like you to work on it. So that's the thing where I tell people, like, there are times when you can be put on the wait list and then be pulled off the wait list because you actually did something to like further your application. Because a lot of times if you go on the wait list, unfortunately, you're probably not coming off the wait list because there's so many candidates that are applying, and they're going to always wait to see these fresh new faces come through before they go back and start trying to reevaluate people that already looked at once, so that's why I said, like, if you give us a reason to look at you again, 100%, so I tell people, like, if you get an email from us that says, thank you for applying, we put your application on the wait list for further consideration. Some people look at that as like a positive thing, like, great, like, I'm on this wait list, I'm like, I'm in the line at Disney to get on my ride, and I'm eventually going to get there and get to ride the ride. But that's not really what this is. It's kind of a line that you stand in that actually the ride's been closed for a while. So unless you give us a reason to reopen that ride and let you in, which could definitely be like, hey, your GRE scores are a little bit low, and you're like, you know what, I just retook my GRE scores, here they are. And they're like, awesome, those are great, we'll now interview you. So you kind of have to be a little proactive if you get a wait list email, and don't be scared to ask us, like, can you tell me possibly, because sometimes it's something that may not be able to be fixed real quick. It might be your GPA, like, your GPA is a little bit low right now, so whether or not you can fix that in a quick method, or maybe like, hey, I just got straight A's the last 2 semesters and that didn't reflect, or whatever. But most of the time GPA is going to take, maybe a year to rectify. But we'll 100%, can reevaluate stuff for people that are on the wait list if there's a reason to do it. So, but hopefully everybody gets an invite for an interview, and that's kind of what we're shooting for. So interviews this past year were kind of all over the place in terms of the programs, because some programs did, hybrid, but like PA only did virtual. They did nothing but virtual interviews. I think this year they're going to do a hybrid where they'll offer in person. They'll also offer virtual interviews. So depending on the applicant, you can kind of choose which environment you want. A lot of our programs, like speech pathology, that's what we did this year. We also did it with veterinary medicine, so students can kind of pick and choose what they wanted. And a lot of people are attracted, obviously, to virtual because it's cheap. You can show up with just a nice shirt on and interview. But I always tell people, like, if we're really a strong consideration for you, if we're really a school you're super interested in attending, and you can make a physical interview, make the physical interview. Like, I think it presents better personally. And I just think you're going to have a better experience all around. I think actually being here on campus, being able to tour the campus and see the facilities, and, get to see the clinics, and, do student panel face-to-face with people. I mean, I think it's a better experience all around. But I mean, it's really up to the candidate, and we don't hold it against people. That I don't want you to think that we're like, oh, you interviewed virtually, we're not taking you. Like, that really plays no impact in terms of their decision-making process. But I just feel like, as an interviewer, I've interviewed quite a few people this year. Like, I'd like to be able to sit across from somebody face-to-face in a real room and talk to them and have a conversation and kind of pick up on just like social cues and stuff like that, and just see, because ultimately, when we're interviewing students, I tell people, like, a lot of these people, these are faculty, these are going to be the people that are teaching you. So they're looking at you through the lens of, like, are you a teachable student? Are you somebody who's going to be like a good collaborator? Somebody who's going to be a good classmate, somebody who's going to bring like a positive enforcement to the classroom and stuff like that. So, we don't, they're very conversational interviews. Our interviews are, depending on what you're interviewing for, because again, the structure is different. Like for PA, it's actually a panel interview. You interview with 2 other candidates, with 2 faculty members, for about an hour. Where with our other programs, you might interview by yourself with a couple faculty members for half an hour. Or like with speech pathology, you interview by yourself for 15 minutes. So it's a very, every program has their own kind of tried and true method and what they think is going to extract the information they need to make a good informed decision on who a good candidate is. So we leave it up to them to do that. But I know at the end of the day, most of our programs are not trying to put you through any grueling process. They're just trying to get to know you as a person and kind of your true passion for what you want to do. So, but after you've interviewed either virtually or in person, usually within a couple of weeks, we make decisions. And then the decisions fall into these, again, three categories. We have an acceptance list, we have an alternate list, we have a deny list. So usually, the unfortunate circumstance where you get denied after your interview, I can almost guarantee you was 100% your interview. Like, we're not going to bring you here and then deny you because your grades aren't good enough, or something in your application. Like you would never even interviewed if anything on your application wasn't strong enough. So really at this point, if you're being denied after your interview, it's just because of, we do have people that get here and they just freeze up. This is their first professional interview. They have a hard time articulating themselves, and that's nerves. It's understandable, but at the same time, you also have to be able to articulate yourself. And so what you see is those people ultimately reapplying the following year and then hopefully doing a better job. But most of the time, I think the majority of our candidates end up being accepts or alternates. We try not to deny a lot of people. Sometimes it has to happen. But accepts, alternates, accept, obviously, great. We love you. Hopefully you love us and you want to come to school here. Alternate is more so, and especially early in the cycle, we tend to put a lot of people as alternates because we have so many people we still need to interview. And so you don't want to like overfill your class before you have a chance to evaluate all of your candidates that are coming into interview. So it's like, hey, you're a really good candidate. We like you. We're just going to put you off to the side here for a second, and then we can come back and give you an offer down the road. So like with PA, we've been going through quite a few alternates recently, just kind of filling our class, coming back, and then be able to take in those people now that we've finished all of our interviews and we know what kind of seats we have left. So if you're an alternate, it doesn't by no means mean you're not going to come to school here. It's just obviously not quite as clear as being an accept, but that's how that works. All right, so competitive applicant, you can look at this stuff and kind of take it for what it's worth. I mean, strong academic history, obviously, that's great. Courses beyond prereqs. So what that is kind of like for me, going back to that scenario where I said, like, I always throw because myself, this is my scenario. I have my bachelor's degree in broadcast journalism. Not using that right now. But if I wanted to go to PA school, I could go take the prereqs. And if I did go to GRE and get healthcare experience, I'd probably have a good opportunity. But if I'm going against somebody who is one of you that maybe has a bachelor's degree in biochemistry or something like that, you're going to look a little more prepared. You've had more classes, you've had more experiences in the hard sciences where me who just went and took the prereqs, So I'm not saying you can't do it that route because it does exist, but I do think they like to see it. That's even why I said like biochemistry is not required, but strongly recommended. Just, seeing that you've kind of pushed yourself and you've taken some other coursework to really prepare yourself for what you're going to encounter here. Completed prereqs. So you can 100% apply to any of these programs with prereqs in session. That's just common course. So, now, obviously, if you have them all done already, yeah, it calms our nerves a little bit. We know there's not going to be that ever scenario where you show up and like, you know what, I didn't actually get around to taking organic chemistry, because then you can't get around to being in our program. They will make you reapply and start over the next year. But, most students, I would say, come in or apply with one or two classes at least that are in session. So don't worry about that. If that's your scenario, it does not affect your application one iota. It does not affect our evaluation of you at all. Healthcare certifications. So some programs like PA loves to see certificated physicians. I'll tell you that. Like they like to see people because obviously you have to put a little more time and effort into getting certificated. So EMTs, CNAs, those type of things are great. For dental, obviously, if you're a dental hygienist or pharmacy, pharmatech, those things are great. I never tell somebody though, like go pursue that. You have to go do that. Like if you've got it or you have the opportunity to do it, then great, do it. But don't feel like you're going to be at a disadvantage because you don't have a certificated position at all, but if you do, great, you got a little feather in your cap. And again, so these paid volunteer experience, shadowing experience, leadership, this is all just kind of like, like I said, depending on the program, PA, you have to have paid experience. Like, but it doesn't really say it, but you need to have it, shadowing experience, kind of going back to dental, let's talk about dental. Like they want to see at least 125 hours of dental shadowing. So there are areas, vet med, we talked about, you need 240 hours of animal experience, shadowing or working or something like that. So, each field's going to have their own kind of thing they're looking for. PT wants 60 hours of observation. So just getting out there and doing those things and just trying to get as much experience as you can, great. But like leadership positions, I didn't put this on here, honestly. I took this and, like if you have them, great, it's like a little, added thing, but I don't know how much. This next slide, I think kind of says a lot about this because this actually used to be shown by our assistant dean for the dental program. So anytime we'd have applicants come to interview, he'd do a presentation with those people that were getting ready to interview. He wanted to lay out to them, like, this is what we look for in applicants and this is what holds the most muster, So at the top of the chain, academic achievement, like that is the heaviest thing, your BCP, your science GPA, your DAT, your course loads, those are the top, and then as we trickle down here, obviously your interview is going to hold some weight. Personal statement. Now, every program does their own thing. I can tell you PA doesn't care much about a personal statement. Like you got to write one, but it's not going to be like the end all be all, like, oh, we need to interview this student and accept them because they wrote a great personal statement. Letters of recommendation, I think, are much more important than personal statement. So, we look at those pretty heavily. But then these other things, like leadership position, the very bottom, dental shadow, the shadowing, things like that. So really these core things up here, paid experience should be up here a little bit higher, if you're PA and stuff like that. But this, I think, is a pretty good little, synopsis of really what holds the weight and what gets people interviews and accepted ultimately into programs. So. And then I think this might be my last slide before the end. So this is all the requirements across the board. So this isn't for every single program. So don't look at this and freak out. I just throw this up here just to kind of let people know, in terms of when we're evaluating applicants, we're pretty lenient. So if something says 2 semesters of biology, it can be any biology class whatsoever. As long as it doesn't specify, like PA says anatomy, we'll take, anything. If you took, genetics or whatever, and have lab associated with it, that would count. You don't necessarily have to take general biology. As long as it's through the biology department with a lab, you're good to go. Gen Chem is pretty self-explanatory, same as OChem. Anatomy and physiology, depending on the program, you might have to take 1 or 2 semesters. Same thing with physics. And then any program that requires a certain, like, so dental requires microbiology. You obviously can't ever double dip. You can't use microbiology to also satisfy your general biology or biology credit. Those are going to be separate things. We kind of already talked about English, so we're pretty lenient there. Same thing with math, college algebra or higher. We will also accept AP credit. So if any of you have AP credit that you got from taking classes in high school, as long as it's stated on your official college transcript and it says 3 credits, AP credit granted for English, biology, whatever, we'll take it, you're good to go. Outside of that, general education, I think the only thing here that uses general education is our perfusion, our cardiac perfusion program. And that's pretty much every other class you could possibly take in college besides hard sciences, English or math. So if you took history classes or you took foreign language or something along that lines, those would fall into the general education. So, and that being said, my friends, is my presentation with about 20 minutes to spare. So is there any questions or anything you guys wanted that I can answer for you guys?
Any students have specific questions about the program they're interested in? I know we still have Cassie in the room. She's pre-dental. Haley and Reese are both pre-PA.
I'm going to look through some of these. Chandler looks like he left, but I'll just answer his question because he said he wanted to know where letters of recommendation fit into the groove. Currently scribing for a remote company, so I don't know if specific your letter of recommendation is assured. Would an MD letter of recommendation be tolerable? So yes. So with our DO program, it just says DO or MD. So if all you can get is an MD, that 100% works fine. The one thing I just tell people is if you're applying to an osteopathic school, especially if you're interviewing, have a good knowledge of osteopathic medicine and the differences between osteopathic and allopathic medicine. Because we know ultimately there's a lot of students that apply to DO school because they want to go to med school, and DO schools tend to have a little lower, threshold. It's probably generally tends to be a little bit easier academically to get in DO schools than it is MD schools. So you do see students that go the DO route opposed to the MD route just because it's a little bit easier to get into, but you still have to interview and you need to show, like, you can't be like, oh, well, couldn't get an MD, so I'm going to DO, you know, like they'll ask you those questions about the different tenets of osteopathic medicine and, you know, why osteopathic medicine, you know, opposed to you. And, you know, we get the same kind of generic, oh, it's holistic, you know, and they hate that. So that would be my one bit of advice is like, A, feel fine, free, or, you know, confident in just sending an MD letter, because that's really not going to be the end all be all. The interview is going to play much more of a role, and that's going to really tell them, like, you know, are you really truly passionate about osteopathic medicine, or are you just coming here because, you know, it's your backup plan? So
I actually have a couple questions. So I'm pre-dental.
okay.
And I was just wondering, so I'm an international student too. Do you guys accept international student at Midwestern?
Yes.
And okay, thank you. And if so, so I did my undergrad at Boise State, and do I need to like retake the TOEFL exam?
No, we don't require the TOEFL.
Okay, cool.
Yep. Nope.
Okay.
All you would need is just your transcripts from Boise State. You'll have to take the DAT. And but yeah, we take international students every single year. Quite a few. Yeah. So you will not be alone. Like, I mean, if you look at our, like I got to talk about, like our demographic is normally, you know, it's 25% Arizona to the rest of it is like out of state international students. You know, we get a lot of people from Canada, you know, different, you know, so there are people from all over that come to school here.
All right, thank you.
You're welcome.
And also, I have another question. So you said the transcripts. So when you enter your, I know there's like a section in Access, you have to like manually enter your grades. Do we need to like request transcripts as well, like when you submit your application?
Yep. So when you go through AdSAS, you have to send them pretty much transcripts from everywhere you've ever gone to school besides high school.
Okay.
And then they'll be the ones that, you know, you because they'll generally upload. I think they, you know, they input a lot of your classes for you, but then you'll generally designate like prerequisite courses and stuff. So like if it says, you know, have you taken biology, you know, to satisfy this requirement, then you put, yes, I took this and this, and microbiology, this and this, you know. And so, and I think there's different services they offer and whether you're willing to pay for it and stuff like that, you know, that make your life a little bit easier. So it's kind of up to you, but yeah.
And a shameless plug. So next Monday, Cassie and everybody who's in the room, we have our application workshop from 5 to 6:30 in person and via Zoom. Okay. And we'll be going over the entire application process for all of the CAS systems. So you're more than welcome to attend that. So just as a shameless plug for my program that's next Monday.
Awesome.
All right, thank you.
Reese did have a question about PA letters, and does one need to be from a physician assistant?
It's not required that one's from a physician assistant, but if you can get one, I would say it's great. You know, like programs definitely do like to see practicing professionals in the field that you're, you know, desiring to get into, but they don't have, you know, PA is one of those ones where it can be from anybody really. So, but if it can't be, I mean, I would say if you can get somebody in the healthcare profession to write you a letter, if it's not a PA, that's probably good. Because I think it's a good rule of thumb to have somebody in the academic realm and then somebody in the professional realm, you know, that write you letters. And then, you know, that kind of gives them a glimpse into both sides, like, oh, they're a great student, but they're also a great worker, you know. So, but yeah, it doesn't have to be from PA, but definitely if you can get one, I would say do it.
Okay. Any other questions?
So I have another question. I looked at the prices for like the PA schools online, and it said that it was about 60 grand. Was that for both years, like for the full PA program, or was that just the first year?
That's just 1 year.
Okay, that makes a lot more sense. I was confused why it was not 120 grand.
Yeah, it'd be nice if it was for both years, but no, yeah, that's just 1 year, but it is 24-month program now, so it would be about 120 for the full time frame.
Okay, thank you.
Yeah, you're welcome.
Other questions?
Yeah, I also have another question
Yeah.
regarding shadowing hours. So I think you said for dental it's about like 120 or something like that. Is like if we have less than that, do you think that can be like they would not like consider us?
I think
Or-
it depends on how close you are, honestly, because if you're dramatically closer in that, then I would say, yeah, they won't. I mean, it's such a competitive field
Mm,
that, they're gonna
yeah,
want to see, but like, let's say you had 80, 90, 100 even, you're good. But if you're coming in with like 20, 30, yeah, like it's just too many other applicants that you're going up against, that
yeah.
to them, that's going to be a weakness and just kind of like a, you know,
The thing is that I have about like 65, but it's out of the US.
okay, so it's all like foreign based.
Yeah, it's like in France. So I my only experience here is like the virtual shadowing.
Okay. Well, and I mean, and you can still include that. I mean, we understand like COVID wrecked a lot of stuff, and it put people in the positions where they couldn't go do the shadowing they may have done traditionally. So I would still include those hours, those virtual hours,
Yeah.
100%, and I would still 100% apply. I mean, especially if the rest of your application is good, and they'll still accept your foreign-based shadowing too. So I don't feel like they're going to look at it any less because, you have foreign-based shadowing. But if everything else is good, how many hours did you do virtually?
I have about like 30 hours right now.
I mean, I think you're still in a good position. Like I said, if everything else is good, I mean, I don't know your GPA, I don't know your DAT scores and stuff like that, but if those are on par with what I told you earlier or better or something, I think you'd still have a great opportunity to interview with the program.
All right. Thank you so much.
Yeah, you're welcome.
Any other questions for the group? All right.